Congrats on getting your braces on. Our office will give you the best smile and bite possible, but we need your help. By following the guidelines that will be discussed throughout this video, you will help make this happen because we can't do it alone. Proper brushing. You must see your dentist for regular cleanings and checkups every 6 months. To prevent damage to your teeth, thorough hygiene is imperative. Poor care of your teeth can and will cause permanent damage to them. Develop a pattern of brushing that covers all surfaces of all teeth. Move in circle, ovular motions. Tilt your brush and brush slowly because that's where plaque and debris accumulate. Concentrate on the gum, gently placing the bristles under the gum tissue. Focus on spots that have hooks or attachments because plaque and food particles accumulate here. Brush chewing and biting surfaces of teeth, the inside surfaces of the teeth, and especially your tongue. Brush till they shine after every meal, at bedtime. You can also use fluoride rinse at night. Always swish water vigorously between your teeth whenever you have a chance. The added benefit is substantial. The proxy tip. This is a special kind of brush for those hard to reach places. Place the brush gently under the arch wire and between the brackets. If there's space, gently push it inside with a rotating motion. Water pick. This may be used to remove large particles, direct the water streaming away from the gum tissue. Flossing. Floss all areas between teeth. Flossing is important to prevent cavities, infected or swollen gums, or permanent white spots on teeth. The key to flossing is to get under the arch wire. Super Floss is a great floss that can be bought at any Walmart, Target, Walgreens that has a stiff end that makes it easier to place and thread through each bracket. Or you can use a floss threader. Place the floss and wrap it around one tooth in the shape of a C, making sure it goes under the gum tissue. Complete it with the adjacent side and remove the floss. Repeat for each tooth. Flossing does take time, but this will prevent dental disease. You should floss once a day, usually at night before bedtime. The more often, the better. Disclosing tablets or plaque indicating tablets help you identify areas that haven't been brushed adequately. After done brushing, chew one tablet, swish, and evaluate. It will stain your teeth where more attention is needed. Or use a brush with gel-formed plaque indicator and see the visibility of the plaque that remains on the teeth. The stain is easily removed by rebrushing the areas you missed. Clear elastics. Avoid excessive coffee, tea, mustard, red wine, and curried foods because they stain the ties that hold the arch wire into place. Smoking is disastrous. The braces, they deliver the forces that will actively straighten your teeth. The brackets, those are the individual attachments bonded to each tooth that can be metal or clear. The bands are metal rings with special attachments that are carefully placed around the back teeth. Arch wire. This wire is engaged into each bracket and band and delivers the forces to straighten teeth. Elastic ties. These are small rubber bands that hold the wire into the brackets. Ligature wire. This is a stronger attachment that is used to hold the wire when a tooth is rotated or needs extra force holding the wire in. The power chain links the teeth together and closes those spaces. This might cause pokey wires as spaces close, but that is expected. You may use wax on the wires or call to have an appointment set to have those wires clipped. Hooks on brackets are used on certain brackets that don't have them. These hooks are added on to allow patients to wear elastics to fix their bite. Elastics and rubber bands are used to adjust the bite. They are applied by the patient and need to be worn 20 hours of the day to correct the bite. The more you wear these, the quicker you can get your braces off. Spacers. These rubber spacers are used to create space between teeth to be able to fit metal bands around those back teeth. When flossing, floss between all other teeth but the ones with those spacers. If flossed or picked at, or if a patient eats sticky or chewy foods, those spacers can come out. Expanders. This is an upper appliance that places pressure on the upper jaw by turning a midline screw. The pressure widens the upper palate, which corrects the crossbites and creates space for permanent teeth to come in to their proper place and position. When getting this in, there is no pain, just pressure. Doctor will instruct the patient and family on how many turns are needed and when the patient's follow-up visit will be. At that next follow-up appointment, the doctor will evaluate if there was enough expansion or if more turns are needed. Diet control. Patients may need to avoid or change certain foods that normally would be eaten. This can help save you on costly repairs and possible delays in treatment time if we are not eating brace-approved foods. Gum may be chewed as long as it is sugar-free. Actually, chewing sugar-free gum helps with relieving pain and discomfort. No chewy, sticky foods like caramels, licorice, now and laters, Starburst, or Skittles. No hard foods like pretzels, nuts, hard taco shells, tortilla chips, and mints. Minimize sugar intake like cookies, candy, soda that is full of sugar, high sugar fruit juices, etc. Don't forget to brush or rinse right after eating sugars. When eating apples and carrots, you need to cut them into bite-sized pieces, as well as cutting the corn away from the cob and meat away from the bone. Harmful habits: chewing on ice, pens, pencils, biting your fingernails, or picking at your braces. Why? Because they cause loose bands and brackets, distorted arch wires, unwanted movement, and increases your treatment time. Please do not play with your braces and avoid hard, chewy, and sticky foods. Headgear. Don't engage in any activity or horseplay with headgear. It can be extremely dangerous. Mouth guards. Mouth guards should be worn with any contact sport over your braces. We can provide you with a generic mouth guard or make you a personalized one for an additional cost. Emergencies. A bracket or band can become distorted or displaced, usually from eating wrong foods, chewing on something hard, or picking at your braces. It is not an emergency unless it is causing the patient discomfort. Call for an appointment to have the loose bracket replaced and we will fit you into our schedule as soon as possible. These appointments require extra time and usually can't be done after school or work hours. If a tie happens to come off and it's only 1 or 2, the patient doesn't need to worry about coming in to have them replaced. If there is a gap between a few teeth with no brackets because they are baby teeth or not fully erupted yet, it might be possible that the wire may come out more easily. You may try to reinsert it back into the tube with a pair of tweezers or place wax in it to hold its place. Your last resort should be to cut the wire closest to the next bracket with nail clippers or small wire cutters. Please, if you need to cut the wire, remember to call the office before doing so. For pokey metal ties, use the back of a pencil or eraser to tuck it out of harm's way or use wax. Wax can be applied by pinching off a small portion, rolling it into a small ball, and placing on the applied area. The key to getting wax to adhere is to dry the area, then mold the wax to the area of discomfort. Reapply after eating and brushing. Having difficulty with these, please feel free to call the office for answers to your questions and to schedule an appointment. Minor discomfort. You may experience some soreness or discomfort, especially after an adjustment appointment for about 1 to 4 days. Aspirins such as Advil and Motrin will alleviate discomfort, and for children, we recommend children's Tylenol. For children under the age of 12, please follow the correct dosage on the back of the box. Warm salt water reduces swelling and inflamed gums. The proportions are about 8 ounces of water to 1 teaspoon of salt. Topical anesthetics can also help relieve discomfort. Bite wafers are provided at the front desk and are a special designed piece of plastic that is to significantly reduce pain after an appointment. It is essential to bite on this immediately after the patient's appointment. That way you intercept the discomfort before it even begins. This will help the patient to continue to eat regular foods, avoid pain and inconvenience. For more questions or information, feel free to visit our website at lasvegasbraces.com.